Hello, my name is Erika Claire, and I'm presenting this descriptive analysis on mental health of homeless people and migrants in shelters during the COVID-19 pandemic in Tijuana, Mexico. I am presenting on behalf of my partners, members of the Human Interaction Laboratory, which I lead in the Universidad Iberoamericana, Tijuana. And this work is the result of the collaboration of our lab with Prevencasa, this nonprofit organization, and it is part of a broader research project on psychosocial effects of COVID in the Mexican-USA border. This is our agenda, a regular one, and I will emphasize on our results and discussion. I will present in this conference a mental health and life conditions illustration of users of a health services facility for minorities in Tijuana, Mexico during the first 6 months of pandemic. International reports show the increase in vulnerabilities of people living on the streets and asylum seekers during pandemic. Tijuana, Mexico is experiencing a migration crisis that occurred prior the pandemic due to the hardening of USA immigration policies that made it difficult for population to move. So people stay stuck here and the capacity of shelters was exceeded. In such a difficult conditions is expected deterioration of mental health population living in shelters and streets. There are very few studies on homeless population and there are no studies on mental health in this specific population. Thus, the purpose of this work is to show the changes in the living conditions of minorities during that pandemic and their mental health problems. As you can see, the study was from in Tijuana, Mexico, the border city where you will find the busiest border at the world according to the CBP records. This is a pin of a Google map where we can see it that is the closest Mexican city to California state in the USA. We used a sample of 67 users of services from a nonprofit organization that I mentioned already, Prevencasa, that is located in the Tijuana, it is here, red zone. It is the well-known red zone. There are high rates on criminality, homeless people, drug trafficking, commercial sex, and the greater concentration of shelters and ed centers in the city. As you can see, it is an area that is very close to the border, separated only by a 4-lane road. You can always see people around, and there are important feeding organizations for homeless around here. Here is a picture of the north area. You can see the border wall behind this bridge. That is actually one that is coming from the San Isidro and port of entry here in Tijuana. We use, our method was a mixed method. We use electronic tablets and smartphones to verbally apply 110 question survey. Lasting about an hour to explore changes in income, housing, access to health services, depression, anxiety, and sleep disturbances during pandemic, in the moment that pandemic was already going on. We apply our service from September to November, interview around 73 people, but 10 were dismissed because didn't complete the survey or repeated with another interviewer. We provide them with a snack while they were answering. All of them were client of medical service, syringe exchange program, or they were in the street out of the facility. They signed consent forms and accepted voluntary participation. During interviews, we use masks and social distancing protocols. Also, the facility in Prevencasa had sinks to wash hands and a bar to check temperature before being allowed entry and use of any services. When we then, after collecting all the data, we use SPSS to analyze them, trying to summarize and finding associations. This is a part of our demographics. Um, I can tell you that our sample consisted of 69 people, most of whom self-identified as men, with a mean of 44 years of age. As many as 73% are single. They were school. Um, they were school below college, except for 6%, and 12% reported having a psychiatric diagnosis. Also, 64% regularly used drugs. Almost 40% had no documentation papers. This is very important. 44% were migrant and 63% were homeless. First data we obtained was on adherence to COVID prevention recommendations. 70% reported having a place where to isolate in case they acquire COVID-19, which coincides with the percentage of people having access to hand washing. Also, despite of the energetic campaigns on mask use, 38% said they will use masks only in case it would be required. For example, to use the medical services facility in Prevencasa, they are required to do so. Moreover, social distancing is something not always employed, but only by 21%. This is one of the changes we could obtain regarding income. More than 60% decrease or stop their economic activity, which regularly was based on informal services on street corners and junctions, as well as helping with running errands for some of the business around the area. But this diminish because of the condition. Our results, as I said, we made measurements on anxiety and depression. With the Beck scale, we observe a frequency of 26% of population with moderate anxiety and 40% displaying severe anxiety. We looked for associations with different variables, and the only two with significant differences were based on their income changes and having documentation that I showing you now. Oh, sorry. So we found that the two groups with severe anxiety consisted of people that stop or decrease their income. As well, those with no documents are also those with severe anxiety. In a scale from 0 to 30, the mean of the general population was 10. Here you can see the distribution of our data, which was translated in 41% of people with high risk in clinical depression. We did not find any significant differences after grouping by demographics. So this is what I decided to show you. Finally, and considering mental and physical health needs, we found out that this population lacks access to the public health system, and they just employ their limited resources to receive the help provided by non-profit organizations such as Preven Casa. We asked them about their expectations on the post-pandemic times, and it was interesting to find they mostly are pessimistic. 23% said not having expectations, and 27 reported feeling is going to be worse. Here is a sample of thoughts about the times of the pandemic. We included an open question that was verbally answered and transcribed by our surveyors. There is a coincidence in feeling that they are not in control of their own lives, being subject to the will of God. In part, we observe here that there is a lack of sense of agency in themselves. For example, everything is a lie. I have not thought about it, but I am seeing the hardest situation, describing the situation. Times will be worse. Economic difficulties start from scratch. There is not support. The Bible says it all. When it touches, it touches. When one is going to die, one is going to die. We depend on God. It is a general thought appears in our findings. Results reflected, our discussion is in part like this. There are a lot of different thoughts after data of this population that is not very deep study or with no so much focus. Results reflect the international situation experienced by the homeless and migrant population, even prior to the pandemic. Despite MPP agreements that our country had signed, there is not any commitment to help migrants with vaccines or general access to health services. We observe that without documentation, it is impossible to access to any public service or vaccine. So the question is how to help them to gain access. They survive, this population survived due to humanitarian help from non-profit local organizations. There is no budget that includes the homeless population, even when the campaigns started with vulnerable population, this population is not under consideration. Governments are called upon to focus on addressing asylum policies and allocating resources to mental health care for the most disadvantaged. And this was an illustration of how they are living these times. Thank you very much to all us. Mainly, I would like to thank firstly our participants, users of Preven Casa services and Preven Casa themselves for allowing us to see their work and understand the population, to the students of the lab, and for the research department at the university for the funding. Thank you all for your attention.